Hello, dear friends. My name is Sofia Dorinskaya. I am a doctor. Today, we will talk about a letter that I received on the Dorinskaya online website. This is a website with recommendations that you can get for yourself and follow. These are recommendations based on almost a decade of our work, with thousands and thousands of cases, and these are very well considered recommendations. So, let me read you the letter. It's written by a woman. She writes about uterine bleeding that has been going on for 2 weeks already, and she is taking Narcolet 5 mg twice a day. As I understand it, she has already had a curettage because of this, and now they are sending her for another one, but she doesn't want to go anymore. I always say, and it's written in our recommendations, that if you are taking any medications, you always have to look at the side effects of those drugs. What do we notice at first glance? The medication she's taking, Narcolet, has a side effect, doesn't it? Uterine bleeding, nausea, vomiting, and metrorrhagia, this is what it's called, means the appearance of bloody discharge, uterine bleeding, during the intermenstrual period. So in fact, this person is being managed very incompetently by her doctors. He is taking a substance that causes bleeding. Instead of figuring out the reasons for this, women are sent for a scraping procedure. At the same time, as I understand it, no one was going to stop prescribing Narcolet. What do I want to tell you, and what do I want to draw your attention to? On our website, there are recommendations for reproductive function. This includes premenstrual syndrome, female menopause, early menopause, and severe menopause. Clearly, the woman is taking a hormonal medication for some issue. Either she has premenstrual syndrome or she is already showing signs of early menopause. I want to encourage you, before rushing into heavy hormonal therapies with synthetic external hormones, before very roughly interfering with your endocrine system, I urge you to simply follow these recommendations. First of all, it's safe, because nutrition has never harmed anyone. Secondly, all the science that has worked with vitamins. Academician Dombrovskaya pointed out to us that it is vitamins that are substances without which our endocrine system cannot live, cannot function. And it is specifically the vitamin regimen. And in these recommendations, there are not only vitamin regimens, but also guidelines on how to eat properly. That is where the very quintessence of knowledge, the quintessence of actions, is found. What needs to be done to help restore your reproductive function? And let's read a review from a woman who followed these recommendations. I recently received a thank you note for the recommendations, and I'll post it on the website soon. I'll read it to you now, and you can check it later when I upload the text. Thank you. Hello, dear Sofia Rashidovna. Thank you so much. I am 50 years and 2 months old. I took the vitamins as recommended for early menopause. So this woman chose the early menopause option for herself. I feel like myself again. I completely forgot about the hot flashes. My sleep has returned, and I don't get up at night anymore. The urinary leakage and frequent trips to the bathroom have stopped, and during the day, the moisture in the vagina has been restored, which is very encouraging. I stopped lying down on the couch during the day. I have the desire to cook and keep the house clean. I have ideas for developing my own business, and I actually want to work. My blood pressure is normal. Thank you again. This is what they do. proper recommendations based on genuine knowledge of how the human body works. That's why I can't discourage you from going to doctors. I'm a doctor myself, so that would just be nonsense for me. But if you're prescribed this heavy hormonal artillery, it's clear that we're talking about chronic conditions here. You know, when a week or two doesn't make a difference, even a month won't make a difference. First, use a safe solution. It's always justified. And that's how you should treat your body. When you have a solution, when you have a problem, you never rush into a solution. The hardest part is when you have a headache, before you cut it off. You know, there's still a certain range of actions that might actually fix this headache. So start with something safe. Based on genuine scientific knowledge, start with something safe. Start by correcting your own diet and vitamin regimen, which will simply provide your endocrine system with the necessary nutrients so it can begin to function harmoniously. I assure you, in a huge number of cases, the problem will be solved. If not in 100% of cases, the problem will be solved just as it was before. Just like with the woman who wrote to us, thank you very much. The review that I will post on the website and share in our groups. Thank you very much.